Welcome back to the third part in this five-part series. Now we're looking at the phase of when an acute disease goes past the first layer of where it's cold and contracted, which is the wind phase, right? And when it ends up in the heat phase, when it ends up febrile, right? And so this is common. You've experienced this a lot. You know, this is you feel like you've got a fever. You might have a little bit of a sweat. You could have some more different kind of aches and pains happening. You may be more thirsty. You may want to take layers off, right? All of these sorts of things. And it doesn't feel like a cold anymore. And perhaps if you've got mucus, it could start to thicken, right, at this point. Thicken in a yellow way is when it really starts to get hot. You know?
So the image that we've got here from Galen is like closing the vents on a fire.
Yes. So something that starts off contracting, like the wind, that closes the pores. Galen spoke about the way in which if you close the flues on a fireplace inside your home, right, the vents, then what happens is that at the start you've got an increase in heat because the heat can't radiate out so easily, so the furnace gets hotter. But you also have an accumulation of smoky vapors, he says, right? And so this is what happens is that first cold and wind, the cold wind contracts the pores and it closes off in this way. We've got it on the wind like the malaria. It contracts, and then once everything's contracted, then our own metabolic processes, our own activity of our immunological fight, that dynamic activity creates heat, right? That's what's happening. The immune cells are going like this as well, you know, against each other, and you've got heat accumulate. So it starts off cold and it gets hot. And so there's a core part of the progression of disease that we need to know, is that you start off with a cold and then it gets to a hot phase. And you want to know, is it still in the cold phase where it's contracted and we need to disperse? And, you know, or has it moved then into a hot phase? And in the hot phase again, we're going to maybe see some perspiration already happening, as opposed to the contracted phase, right? That's where it shifts.
And that's really key, because in the cold phase we also want to warm and disperse, but once it gets to the hot phase, we don't want to warm.
No, that's right. We don't want to warm. You know, we don't want to put them in the bath. We don't want to be giving them cayenne and all of those sorts of things. This is where we draw upon herbs that are cool in the second degree, traditionally in our galenic medicine. These are the antiviral dispersing herbs we spoke about in prevention, right? So these are our classics. Again, my sweet darling elderflower, but we can add to that catnip, and woad is one that's coming back in the West again, is sartus, which is very good for hot infections. I utilise skullcap, western skullcap at this phase, and because it grows locally, I also use mulberry leaf, right? Even in Australia we have mint bush, which has a strong bitter principle that can be used here. Other ones that can be used at a pinch, that are perhaps better suited to later phases, where they really excel, would be bone set and pleurisy root. You can use both of those at this phase as well, if necessary. Does that make sense as the first layer?
Sense, right. Yeah. And so when the pores sort of close, we have this trapped heat, but you spoke about smoky vapors before, which I think probably needs a bit of translation. As I understand it, smoky vapors is like these metabolic wastes.
That's
essentially.
Right. Yes.
Yeah.
So the pores are closed, the heat can't get out, the smoky vapors accumulate. The smoky vapors are the metabolic waste products of all of the immunological activity, right? And so we've got all those inflammasomes, we've got all of those dead white blood cells. We potentially have dead red blood cells or something like this as well with COVID. And that's the smoky vapors. That's the metabolic wastes that are there, right? And so they start to accumulate. And at the start, they're blocking, they're blocking things, but not really significantly. We just want to try and open them up and get them out through those cooling diaphoretics. They're quite gentle herbs at this point. And that if you're a little old lady and this is your symptoms, then giving you elderflower or something like this is going to be very appropriate. In Ayurveda, they could use tulsi. We could use basil. Tulsi is amazing because it's hot right? It's warming. Basil is warming. We wouldn't use basil probably. It's warming, but it doesn't aggravate hot conditions. So you can use all of those things, and you're not going to really harm the little old lady. Whereas if you give her, I don't know, 7 mils of andrographis, she'll end up in the bathroom like.
Because andrographis is very moving and very draining.
That's right. It's a very strong medicine. It's a stronger medicine, right? If we just think of it in that regard, right? It's a stronger. It's more bitter. The children are less likely to want it, right? And specifically, it's cold in the 3rd degree rather than cold in the 2nd degree. And as Culpeper warned us, is like be very careful with cooling medicines because life is heat. So we want to preserve your heat. Heat as in activity, the vital spark of life. So be careful. We don't want to use excessively draining or cooling medicine. So at the first layer, we're just using those diphoretics. But then those smoky vapors, those metabolic wastes that accumulate, they give rise to different symptoms. And so unlike the first phase of contraction that was quite simple, in heat we've got a few different layers, a few different symptom pictures that emerge. And so one of them is that we can go from a slightly hot sore throat to actually really quite swollen glands, right? And so those swollen glands is lymphatic congestion with a background of these other heat signs, where the heat has cooked and coagulated the fluids, right? Like egg white or something like this. And so we've got a different picture here as it's going deeper. You can feel that it's deeper. It's not just hot on the skin. It's like you look at the throat and it's like swollen and red, right?
So the kind of image that I get is like a reduction. It's like a sauce or something. When you want to make a sauce or something thicker and we're cooking it, that's
right.
kind of
thickened.
What's going on.
The humours have been thickened.
Okay.
The biological fluids have been thickened by the heat. And the smoky vapours are accumulating, thickening it as well. Right?
So the body's really starting to feel the load, not being
absolutely.
Able to eliminate all this stuff.
Crisis of elimination. Sure. That's a crucial part of it at the moment. And in addition to trying to kill the virus, which is still relevant, right? We need to stop the body dying underneath its own overload. As we've seen with COVID, we see there's the virus and then there's the cytokine storm. Well, cytokines are smoky vapours in a way, right? Hot smoky vapours. It's the body's response becomes a problem. We see this again and again. It becomes a problem. The body's response becomes a problem when the channels of elimination aren't open.
Okay, and so this is where that singular kill the bug approach is
not enough. That's right. It's because it's like then you'd have the Herxheimer effect or something as well. We've got all this diet, right? We need to kill the bug. We will maintain germ theory, and that's helpful. But we also want to support the host. And supporting the host means helping those channels of elimination so it can get those things out, right? And so whilst at the first layer of heat, then we're just trying to gently open. Yeah. Once it gets in a bit more, that's when it's just like, okay, we need these stronger medicines that are going to go in. They have a stronger metabolic action that will help resolve all of those metabolic wastes. And they're not dispersing, they're draining. They have a kind of downwards action. They're not going out through the skin anymore, right? It's draining heat down like this is the traditional imagery of
those cooked smoky vapors.
That's right. Get them out. And so it means that the liver is, a lot of these things are going to help the liver in its actions, and they could, in large doses, move the bile and be used to move the stool. So examples of draining herbs that are in this category that are no longer dispersing are, the gentlest of these in my book is olive leaf. And so I use olive leaf in a range of preventative formulas as well. And it's not dispersing. It doesn't have that action. It has this action. And it has an action on the liver. And we use olive oil in liver cleansers, and has action on the heart. It has action that's more inside the organs rather than just on the surface, right? So olive leaf, and it's profoundly antiviral. Profoundly antiviral. So it's a really good choice in COVID. And it's, but outside of COVID, it's really good. Would be really good choice in a range of other microbial pandemics as well. It doesn't have to just be a virus, right? And it supports those channels in this regard. It's the gentlest of them. And from there we move on to the berberine herbs, right? In China we've got coptis and Baikal skullcap and philodendron. And in the West we've got our golden seal, our berberis, and the Americans use Oregon grape there, right? And all of these have this a stronger action on metabolism, a stronger action on the liver and the bowels, and the flow of urine as well, helping, Galen would say, helping the bile to the bladder to expel the bile, right? Because the bladder's primary function was in order to get that bile out, the bilirubin, right? And so we can see darker coloured urine at this phase. In the first phase, the urine would be clearer, and at this phase, the urine would be darker. And so they have all of those actions that are going down like this in this way. Right?
So principally, we're releasing a lot of heat. We're heat.
That's
clearing.
right, heat clearing. And so this is important. This is your cytokine storm as well, right? Is that it's the beginning of the body's inflammatory response, because inflammasomes are what ring the bell to say to the immune system, let's go, let's go, let's go, ding, 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 let's go, let's go. It's really good, heat and inflammation. It's like get it all happening. But then they need to be processed. Everything needs to be metabolized. So they're helping more strongly with metabolizing, and they have a center of action that's more here, and it's going downwards in this regard. Now those are all broad and general. If you've got really quite specific symptoms, and it's like really the throat is really the center of what's going on. And a herb that's been neglected in the West of late because we haven't had epidemics, that's definitely something we want to revitalise, is Baptisia, wild indigo. And so it was used in a range of different epidemics in the colonial era by the Americans as well. They got it from the Native American tradition, which is very rich in a range of these. Thanks also to them for bone set and some other herbs that we've been speaking about today. So that is when you've got a very painful sore throat, and specific indications. You also see like a dusky hue to the skin, like a deep kind of red, or to the throat or the mucous membranes. It sort of gets very congested with blood at that point. And it can be used for typhoid, and it can be used when you've got gastrointestinal symptoms. It's a deep, strong medicine for this phase, Baptisia, right? Whereas we spoke previously of woad, Isatis, which is more when it's a bit further out. Those woad, the woad plant is used there.
And diarrhea can also be a symptom of that heat?
That's right. So heat can go to the bowels, right? And the body will try and eliminate it through diarrhea. So some patients will see this. And so in COVID, you see about 10% of people that are getting like gastrointestinal symptoms as in their first phase. So it's complex. They're seeing multiple pictures happening at the same time, but they'll see that going at this particular point, right? And so that's one way that the body tries to eliminate everything that's going on.
To get rid of that heat.
That's right, to get rid of the heat. It's
Okay.
shunting it away in this regard. And so if that's the case, then you might want to moderate that if it's too strong. If it's not too strong, then Hippocrates was really clear, don't mess with it. Let it go. Let it go. It's like the fever. You don't want to bring the fever down. Unless it's really pathological, you leave it alone. You let it happen. If it gets too strong, then we can use perhaps herbs that can stabilize and bind, and that's where pomegranate comes into its own. That's where rhubarb comes into its own. Rhubarb is dose dependent. Small doses will firm up the stool, large doses will drain the stool. If you cook it longer, it'll bind the stool. If you cook it shorter, it'll move the stool, right? And then also mulberry, the bark, which I've been gathering a lot of lately. Who is it? Not Dioscorides, but Gerard says that it both scours and binds. And so you can use that in this phase as well, right? So there's a couple of them. We're wanting to support the body in what it's doing. We don't want to oppose the body unless what's happening looks like it's at the cost of homeostasis. Yeah.
And then we have another dynamic with heat, which is those alternating fever and chills.
Yes.
So
So the final layer as it's going in, right? As the body starts to, the pathogen, we're seeing it get into the deeper layers of the organism, and the body is wearying. Then the picture that emerges then is of the ague, which is chills and fever, right? And so alternating chills and fever, and this is where the vital force, the innate heat, as Galen called it, will rally and try and push it off, and then you go and you get a temperature spike, right? And you get hot, and then it'll just like and the innate heat will stop, and then you'll get chills. And in the chills, the sense is that the pathogen is getting the doors are open. We're not cooking it off, and it's getting into the deeper layers. And so at that phase, then we're not using those draining medicines in the same way. we're using bitter herbs that have a harmonizing quality to them as well. They're a different class of herbs. So a lot of those draining herbs are bitter as well, but they're very draining, hence the name. The bitter harmonizing herbs have a different feeling entirely. Now, the key one in China is buchlorum, which we're using in the West a lot now, but our tradition is blessed thistle. And this is an incredible herb that was used in epidemics again and again and again. And so it's very specific for this alternating chills and fever. And we could add to that bone set as well, can be very useful. And bone set in particular as well, if you've got bone breaking fever and you've got body aches, right? So if you're really seeing body aches as well, it's like, which one would I choose in this area? Well, if you had delirium and mood changes, right, changes in consciousness, then I would go with the blessed thistle. If you've got body aches everywhere and it's just brutal, I've had that, it's really hard, then you go with bone set. They're both very bitter, but they don't have the same central metabolic draining quality as the others.
Right. So what I hear there is that we're in the previous heat stage, where it's just a full-on heat and full-on kind of inflammatory response. The body still has enough vital force to be able to do that. But in the alternating chills and fever, it's like it's going and it just doesn't have enough. And it's going and it just doesn't have enough. So that's why we need herbs that are a little bit more harmonizing and not so almost aggressively.
That's right, yes. You don't want to use those same aggressive herbs at that point because the body is flagging, right? And to put this into modern language, it's really a crisis of the secondary metabolites and the crisis of elimination that's taking place at this point. And that's why we're using herbs for the liver. Again, it's, whether or not they're for the liver or their herbalist's liver, the liver inside every cell of the body, the organelle liver, is up to you. But they're really helping with the body because it's starting to strain underneath the smoky vapors. It's straining underneath the byproducts of activity, all those dead immune cells and things like this. And this is what's happening in COVID, as an example, right? And so why it's so important to think in these broader contexts is that even with the lung symptoms, right, we see that people we're looking for all these respirators, right, and that the lungs can't work, and we thought it's a lung problem, and therefore people are getting on respirators with oxygen. It turns out that the lungs literally are working just fine. What's not working is hemoglobin. And so what's happening there is that, just going to test my memory, but I believe that the virus is disassociating the heme from the hemoglobin, and then the heme causes problems in itself, right, once it's disassociated, and the hemoglobin can't grab oxygen. The lungs are fine. Putting more oxygen in is not really addressing the root, right? And so, but what is necessary is that hemoglobin metabolism, which is about the liver and the spleen, is central to that process of oxygenation at that point. And so just giving cordyceps and rhodiola and rosemary, lung herbs or oxygen-specific herbs like this won't go far enough. We're looking at helping with smoky vapors. We're looking at helping with metabolism at that point, hemoglobin metabolism. And so that's where those same liver herbs become incredibly relevant. Liver, they're also spleen and pancreas herbs, right, at that point. Does that make sense? Yeah, and it's really good because we live it's really good to remember this as herbalists. And it's the other side of specific medicine. And so the amazing herbalist Matthew Wood is championing the specific medicine, specific indications, and this one herb for this one thing. And it's such an important part of our tradition. I can't sing his praises highly enough. However, the other side of that is the most of our history, which is the cure generalis, right? And humoral medicine is not specific in that regard, and use formulas, complex formulas, to address everything, right? It's the other side of this. And whilst we live in a world where the magic bullet is the focus, what's the cause, and therefore what's the magic bullet that's the medicine, the opposite is needed in complex systems. as well. Let's just say as well, where we don't actually understand, and there's so many factors, limiting factors. Even this thing that looks like it's 2% of the problem. If that 2% of the problem thing stops, it creates so much hassle, right? And we see this in the world's economies at the moment. And so that's what's happening with this, why we need these broad metabolic medicines.
And also why we need language that can describe broad patterns and broad processes, because even though heat can manifest as so many different specific things in the body, that language and that word can still encapsulate that whole entire process.
That's right. And so our formulas don't want to just have specificity. They don't just want to have depth in terms of sort of power and how deeply they go down. They want to have breadth. Your formulas want to have breadth, right? And breadth means you're not making a formula which is just 5 versions of the same kind of herb. It's just like a liver formula, and I've got dandelion and St. Mary's and celadonian. Like that's your formula, right? And it's just, they're all analogues of each other. Breadth means that in your lung formula, with lung heat and COVID at that point, you've got celadonian or you've got blessed thistle, because you're supporting in broad senses without having to know the specifics about hemoglobin metabolism. And so that's what those herbs are doing. They're giving that breadth of supports to the body. They do lots of different things, and we call them liver herbs. But they do an enormous amount in terms of, blessed thistle was blessed by Saint Benedictine, I think, or Benedict.
Yeah,
Yes.
it's in the Latin name.
Yes.
So, yeah.
That's right, in the Latin names, Synodium Benedictus, I think. And he was the patron saint of poisons. So it's the antidote herb. So it's antidoting all of the complex poisoning that the body is happening through its own metabolic processes. Yeah? Okay, good. So those are those, just to recap briefly, in the heat phase, we're going through dispersing when it's just on the outside and you sort of like red-cheeked and things like this. Then when it's going in a bit deeper, then we've got herbs that are draining in specific ways matched to the problems. And that was sort of the berberines and angiographis and all of those sorts of things that herbalists are using often in the preventative phase where they don't belong, right? Because they're exhausting as they're draining.
They're
Strong and draining and aggressive, and they're perfect right now. And then at some point when the body's flagging, then we've got this broader antidoting of harmonizing bitters at that point. And that's the final phase of the heat part. Yeah, great. That's all done. Next, we'll be looking at the fluid phase.